Good morning, my friends, from sunny, beautiful New York City. So here we are looking out over the East River. That's the RFK Triborough Bridge. This is Roosevelt Island. That's the 59th Street Bridge over there. This is the hospital for special surgery. And there's my apartment. All right, so good morning, everybody. I am happy to see you. I hope you're all having a great Saturday and that this is the beginning of a really nice weekend for you. So a lot of questions in the group this week, and this one in particular is a question that comes up a lot, and I wanted to address it. There's also a lot of comments that kind of add layers to it, and sometimes I get tired of typing some of the same things over and over again, but I never get tired of talking. So I wanted to just hit this one hard and hopefully give you a little mini webinar here. So this question says, Dear Noah, I've been trying to increase my breathing capacity to meet a peak demand of walking on a flat surface, sidewalk, track, museum, etc., without use of treadmill or other machines, but I'm not succeeding, hoping you can help. I can do 25 to 35 minutes of cardio intervals, inclines, etc. using machines like stationary bike, elliptical, treadmill, step up. My oxygen saturation remains 95 to 96%. Heart rate goes into 140s as it has done in the past, and I feel fatigued but good. However, walking beyond 7 minutes on a flat sidewalk, indoor, track, large store, etc. without use of exercise machines is quite difficult. Last night I walked 8 minutes in my neighborhood one way and stopped to catch my breath, but on the return I had to stop to catch my breath every 2 minutes. Used your webinar lesson on catching my breath. Even walking in a big box store without use of a cart results in heavy sweating despite the heavy AC. So can you suggest ways in which I might exercise to increase my breathing supply when walking unassisted? No machines. I've been trying to walk longer without machines, but now I'm stuck. Sorry for the long post. All right, so like I said, a lot of information here. Let's get started. Me and your friend and my friend, Mr. Monkey are about to go for a little bit, and we will catch you in a couple of minutes. All right, so let's start with principle number one. So very often, very often, people will ask the question, why can I walk this much on the treadmill, but then when I walk on the street, in a big box store, on the tightrope, on the sidewalk, blah, 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 can I only do this much? Okay, so this is something that I talk about all the time, but it's worth refreshing now. There's a lot of new members in the group. So a couple of things. When you are exercising, okay, when you're walking on the treadmill, you basically, I will assume, are holding on with two hands, and there are a couple of differences about walking on a treadmill versus walking on the street. So number one, when you're holding on with both arms, okay, that gives you an inherent mechanical benefit and assistance to breathing, okay? Now, in general, as I talk a lot of times, I talk about what we call open versus closed chain activities. And for example, the muscles of the chest, the muscles of the back, the muscles of the shoulders, when we are not holding on. So in other words, when I'm doing what I call an open chain activity, meaning I am not holding on to anything, okay? The muscles of the chest, the muscles of the back, the muscles of the shoulders work to move the arms and the upper extremity in all different directions. So they work to move them up and down, they work to move them in and out, they work to move them around, forward, backwards, and that's their purpose. However, when we fix the upper extremities, as we do like when we're holding on to a treadmill and leaning down on something, okay, we get a benefit from that because we're no longer moving our arms up and down, in and out, around in circles. What happens is the muscles of the back, the shoulders, the chest, which often function as accessory muscles, what we call accessory muscles of breathing, okay, work in their reverse action. So in other words, they work in their reverse action, whereas normally they might raise your arms up and down. What they do when they're fixed is they actually work to elevate the rib cage and assist the respiratory muscle. So that, in my opinion, is one of the major key factors of all of this, okay? So open chain versus closed chain activity. So what can we do about this, okay? There's a couple of things. Now, I have patients who say to me, okay, so let me just back up for 1 second, okay? So open chain versus closed chain activity. Monk, what you doing? Do your dance. Kick it up, kick it up, kick it up, kick it up. Let's go. Let's go. Okay, so open chain versus closed chain. So the thing is that one thing we could do is close the chain. So a lot of times somebody will come to me and they will say, I can only walk, you know, I don't understand this. I could walk 10 minutes on the treadmill, but when I go outside, I can only walk less than half a block, okay? And I say to them, no, you can't. You can walk much more than a half a block. And they say, no, I can't, trust me. And I say, okay, let's go outside. Now, what do I do? Okay, how can we close the chain? So 2 ways. Number one, you can use a rolling walker. Now, I know a lot of you are saying, oh, over my dead body, or no, I'm not using a rolling walker, or absolutely not, why would I use a rolling walker? And the reason why you might consider using a rolling walker is because it closes the chain. So I'm not talking about a permanent use of a rolling walker, or maybe I am, but the point is that at some point you're asking me, why can't I walk outside? Why can't I walk outside? Okay, you want to be able to walk outside. So what the rolling walker is going to do is, in addition to giving you some balance, in addition to giving you some assist, it's also going to close the chain and give you that respiratory assist that you get on the treadmill. If you don't want to use a rolling walker, or you're at a higher level and you can do more than that, okay, then another option would be to use walking sticks, okay, or walking poles similar to, you might, as if, you know, as if you were walking in the mountains. Now, when I was climbing in Peru, okay, at a high altitude, doing many, many miles per day, one of the things that really made a gigantic difference with my breathing was when I added the walking sticks, because again, walking sticks will give you that little bit of extra assist. It's dividing the workload amongst 4 limbs instead of 2, similarly to the treadmill, but it's also giving you that respiratory assist. So I'm going to imagine that you're on the walking stick right now. So now, by doing this, okay, and the reason why I say walking sticks for the higher level is because that may seem more natural to you and allow you to carry on your more important, you know, your more a gait pattern that is most similar to your own. So again, when you walk on the treadmill, your arms are fixed. You're getting what we call the benefit of what we call closed chain activity, okay, which is going to, number one, divide the weight and the workload amongst 4 limbs instead of 2 limbs. So in other words, your arms and your legs instead of just your legs. Now, that doesn't mean that you should be leaning on your arms. Your arms should just be for balance, and you also get the mechanical assist of the respiratory muscles. All right, what else? All right, other things. The treadmill will also give you a little bit of an assist with the legs and the walking itself. So when you are, Monk, what's going on there? When you are walking outside, okay, you have to understand that this is like walking, even if you're walking on a flat surface, okay? Walking outside compared to walking on a treadmill, walking outside is like walking on an inherent 2% incline. So for those people that say, I hate inclines, or my doctor said I shouldn't do inclines, or I have a bad back and I can't do inclines, or I had hip or knee surgery and I can't do inclines, I'm sorry to break the news to you, but you have to walk some inclines, okay? There is no way, okay, that, now I'm not saying you have to walk at a 15% incline, but what I'm saying is that you, as I say over and over again, your body gets good at doing what you ask it to do. So if you want to be able to walk, you have to walk. If you want to be able to walk up a hill, you have to walk up a hill. If you want to be able to walk upstairs, you have to walk upstairs. Now, I'm not saying to you, get your lazy butt out of that chair and walk upstairs. What I'm saying to you is that is our goal that we will accomplish over time. This is the starting point. Come here, crazy. This dog is crazy. This dog is crazy. Give me a kiss. Come here. Sweet.
Speak. 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 Speak.
Okay, so let's start with a couple of factors. First of all, something that I call open chain versus closed chain activity, which I think is a major factor. So when you're walking on the treadmill, okay, you are holding on with your arms and you're walking with your legs. So in essence, what we're doing is we are dividing the work amongst our legs, although not evenly, instead of just amongst 2 limbs, but amongst 4 limbs. That's one thing. Now, that doesn't mean you should be leaning on the treadmill, okay, and putting all your weight on your arms and your elbows and your shoulders. You shouldn't be, okay? However, it is an assist to just have your arms on the treadmill. So one of the things that I talk about very often is what we call open chain versus closed chain activity. So when my arms are free, okay, in other words, when I'm doing what I call open chain activity, the muscles of my chest, the muscles of my back, the muscles of my shoulders, all of the thoracic muscles work to move my arms up and down, back and forth, around and around. However, when we fix the upper extremities, okay, and that could be walking on a treadmill, that could be leaning like this, that could be leaning over in my chair like this, what happens is, in addition to dividing the workload amongst 4 limbs instead of 2, is that we actually, the muscles of the chest, the back, all the muscles that we talked about that normally will move the upper extremities, they actually work in their reverse action to elevate the rib cage and therefore assist with breathing. So it improves the mechanics of breathing, which is why when we talk about recovery from shortness of breath, one of the first things I say to you is stop and assume the position, which means in a position where you can fix your upper extremities, closing the chain, allowing your muscles of your thorax to assist with breathing. Other things, okay, as I mentioned, when you walk on the treadmill, there's an inherent assist with walking, okay? So as you step forward, the treadmill is going to actually slide your leg back for you. So while you're doing a lot of the work of, you know, stepping forward, and you're doing a lot of the work of walking, there still is a little bit of an assist by nature of the fact that the treadmill will help your leg go back with you, okay? So that means that all things being equal, meaning the same speed and the same incline, walking on a treadmill versus walking outside, it means that when you're walking outside, there is approximately a 2% incline. That's the equivalent of walking at 2% on the treadmill. So that's one thing to have to be taken into account. So as I mentioned, open chain versus closed chain, one way that you could start off walking outside is by closing the chain, and one way to close the chain is by using a walker, okay? And I like rolling walkers. As I mentioned, there are patients that often come in and say things like, wow, look at this ship, check that out. All right, so one way to do it is a rolling walker, another way is walking sticks. Now let's get back to this question. Hold on. All right, so let's talk first of all about vital sounds, okay? So I could do 25 to 30 minutes of cardio intervals, inclines, etc., using machines like stationary bike, elliptical, treadmill, step up. My oxygen saturation remains 95 to 96%. Heart rate goes into 140s as it has done, and I feel fatigued but good. So let's talk about vital signs. So the main vital signs we look at are heart rate, blood pressure, oxygen saturation. So you're talking about a heart rate of 140s. I don't know if that's good for you because everybody is different, okay? Now, it's primarily, okay, as a general rule, okay, it's primarily age related, okay? And the limit that we use at the pulmonary center, all things being equal, which they almost never are equal, is 200 minus your age. So I would say if you're in your 50s to 60s, then, you know, 140 sounds okay, but all of this has to be cleared with your doctor. As far as blood pressure, Monk sees something. What does he see? Oh, I see what he sees. He sees some of his friends coming. And it's funny, that guy is dressed like me for some reason. Okay, so Monk, That's your friend? That's your friend? That's your friend? That's your friend? You see your friend? Where is he? That's a New York City phenomenon that I call friendly dog, unfriendly owner. Look, that's your other friend. Look, that's your friend. FDUO, friendly dog, unfriendly owner. Okay, anyway, back to business. So vital signs. So your oxygen saturation is great at 95, 96. And for blood pressure, as a general rule, okay, what we use at the Pulmonary Wellness and Rehabilitation Center is we will use 200, under 200 if you are 80 years, if you are below 80 years old. And if you're 80 and above, we will allow you to go to a maximum of 180 systolic blood pressure. Now, that doesn't mean we're shooting for 180. Come here. Get up here. Come here. Up. Okay. Sit. Sit. We got business to talk about. All right. So that doesn't mean that we're shooting for 180. It means that that is what we will allow as a maximum at the peak of exercise. So, all right, let's talk about this again. Walking beyond 7 minutes on a flat surface in indoor track, Okay, last night I walked 8 minutes but had to stop frequently. All right, so now let me take all of this and put it together. So what are some suggestions that you could do? So let's say this, anytime we exercise, okay, there are basically 4 main ways that we can adjust our workouts. And they are often referred to as FIT, F-I-T-T. So we can adjust the frequency of exercise, we can adjust the intensity of exercise, we can adjust the time of exercise, and we can adjust the type of exercise. So let me start first with type, okay? So it really, what type of exercise you do is gonna vary. So you mentioned that you use the treadmill, you use the bike, you use the elliptical, blah, blah, blah. And all of these are fine, but you just have to understand that they don't all have the same value. So my choice, as I say over and over again, I think one of the best, if not, I think the best, I'm gonna say I think the best exercise is the treadmill, and that's the one that I think is most effective with our patients. And the reason for that, hey, relax. And the reason why I think the treadmill is so effective is because it's very, very controllable. We can control the speed, we can control the incline. But really, any of these will help, but you're talking about walking outside. So I'm gonna say, and I'm gonna really think of this as how do we transition you from getting more on the treadmill to getting more outside? So first of all, you can increase the frequency. So if you're, and think of it as total, the total workout. So you can work out, I think you should be doing something every day, okay? As far as the intensity, if somebody says to me that they can only do 3 minutes, okay? Let's say at a certain intensity. So let's say you could do 3 minutes at 2.5 miles per hour, okay? Then I would say little by little, if we want to use the same, we can change the intensity or we can change the time. I think that you should be changing both. All right, so you say you could do 25 to 30 minutes of cardio intervals beyond 7 minutes on a flat surface, indoor track, large store, without the use of an exercise machine is quite difficult. So here's one thing I would do. So the first thing is we want to change a combination of intensity and time. So if you want to, I would say the first thing would be to try to increase the time and the distance. So let's say we would slow down the intensity. So if you're used to walking at 2 miles per hour, slow it down to 1.8 miles per hour and do a little bit of time. Then you can vary that with walking at a little quicker pace for a minute. So in other words, if you tell me you could do 7 minutes at 2 miles per hour, let's say we go out, we do 5 minutes at that 2 miles per hour, then you slow down for 2 minutes and catch your breath, but while you're walking. Then you can speed up for a little bit, then you can slow down for a little bit. But little by little, that is how we're going to do it. All right, so you say you've been trying to walk longer without the machines, but now you're stuck. So if you can no longer walk longer, okay, and that means if you try it today and your maximum is 7 minutes, and you try it tomorrow and your maximum is 7 minutes, and you try it the next day and your maximum is 7 minutes, which, by the way, I really don't think that that would happen. Okay, I think that if you tried it today and you did 7 minutes, even if tomorrow you did 30 seconds more, 7.5 minutes, and the next day you did 8 minutes, and the next day you did 8.5 minutes, you get the point. But if you were to do that, okay, even adding, let me just, you know, again, I think one of the problems that people have, Monkey, relax, buddy. I think one of the problems that people have is that they don't think of the long term. So they think, oh, I can only walk 7 minutes, and they think, how am I going to get up to 30 minutes? But let me plant a seed in your head right now. If you walk 7 minutes today, and you walk 7.5 minutes the next day, and you walk 8 minutes the next day, and you walk 8.5 minutes the day after that, okay? Adding 30 seconds, that's what I said, 30 seconds per day, which I can tell you that probably almost everybody can add 30 seconds per day to that walk, okay? That means that you would be adding 15 minutes a month, okay? And that means after the first month of this, you'd be walking over 22 minutes. That means after the second month of this, you'd be walking over 30 minutes. After the third month of this, you'd be walking 45 minutes. After the fourth month, you'd be walking over an hour, okay? Now, I know that there are things that are going to get in the way, the bad back, okay, the bad knees, blah, blah, blah. But what I'm saying is that little steps, little ripples add up to bigger steps and bigger ripples. So think long term, okay? Don't think that you have to do it all at one shot. Come here, Mom. Let's go. Get up here. Get up here. Look at this ship coming. I love New York. All right, back to business. So let's go to some of these comments, okay? So hopefully I've addressed some of this, and I do realize that it's been a little bit more roundabout than my usual way of answering questions, but I'm outside and I thought you might like to see what's going on in New York City today. All right, so let's go to the comments. Same problem at times, so hopefully we have some of the same answers. I have the same problems. Thanks so much for echoing my concerns. Glad I brought it up. I'm sure Noah will get back to us. Here I am. I have the same problems. Can sit on a bike for 30 minutes, only walk for 4 or 5. Can walk longer with a walker. All right, so the bike, okay? And this is why, you know, I'm not one of those people who say all exercise machines are the same, okay? Doing any exercise machine is better than doing no exercise. That's a given. But there's no way on earth that doing a bike, okay, is as good as walking on a treadmill. Not for anything, okay? I'm not talking about cardio, respiratory fitness. I'm talking about if you want to walk, you have to walk. And it doesn't matter if it's walking outside. Monk, there's your friend. Come here. Come here, buddy. Get up here. Get up here. Come on. Get up here. All right, so what I'm saying is that if you want to walk on the walk, okay, you have to be able to, you have to walk. So this is my problem when a lot of places will do stress tests using the bike, okay, for rehab. And the reason why I have a problem with this is because, think about it, okay, you know, if it feels too easy, then trust me, it's too easy, okay? If it doesn't feel like work, then it's not work and it's not going to be beneficial to you. So you're going to get out of it what you put into it. So as an example, there's a program in New York City that I know before rehab. They do their exercise testing and they do their stress testing using an exercise bike. Now, what is the problem with this? The problem is you didn't ask me how can I bike around New York City or how can I bike around the big box store. You asked me how can I walk more, right? So if you think about the bike, and I'll say it doesn't matter if it's the upright bike or the recumbent bike. So in the upright bike, at a minimum, okay, your body weight is supported and you are only moving your legs. So think about that as compared to walking or coming upstairs, stair climbing, okay? So I say to people all the time, you can bike till the cows come home. You could do 2 hours a day on a stationary bike, and that does not mean that you can walk because your weight is supported. And if you think about the recumbent bike, even more of your weight is supported. So upright bike versus recumbent bike, this is a good lesson for now, a little tidbit. So the upright bike is better for you. Why? Because at least in the upright bike, without your trunk supported, you have to balance your thoracic and core muscles from moving backwards and forwards, from moving side to side. So believe it or not, that is exercise, static exercise. Okay, so upright bike will be more beneficial for you than recumbent bike, which basically is kind of like a chaise lounge with pedals, and the only thing that you're missing is a pina colada. Now, I'm not saying don't do the recumbent bike. There is benefit to it, okay? However, it's not as good as the upright bike. The upright bike is not as good at the treadmill as the treadmill. So then there's going to be people who are going to say to me, but I have a bad back, I can't do the upright bike. And of course, we have to take all of the things of your life into account for this, okay? So if you can only do the bike and you can't do the treadmill, which I don't know who that person really is, I think most people can. Monk, that's your friend. Come here, Monk. Bye-bye. Get up here. Come here, Monk. Get up here. Get. All right. So, again, the exercise bike is great, and they're great ways. You know, it's a great aerobic exercise. Make sure that you keep the intensity up, okay? It is a great supplement, okay? And we really use the treadmill as our main meat of the workout, but we supplement with the bike. We supplement with you know, with the upper body ergometer. We supplement with armor size and things like that, okay? But again, a lot of this is common sense if you think about it. Now, we don't want to admit, hey, guess what? I've been doing the thumbs up as my exercise, and I guess that's not really very aerobic, okay? But ask yourself, what is this most like, okay? So walking on the treadmill is most like walking outside. But if you only walk flat on a treadmill, then you're always going to have problems with hills on the outside. You're always going to have problems with stairs, okay? If you want to get good at walking hills, you have to gradually build up to walking hills. If you want to get good at walking stairs, you have to gradually build up to walking stairs. Okay, so again, sitting on the bike is great for 30 minutes. It's a good exercise. It's better than doing nothing. It's much better than doing nothing. So don't be discouraged by what I'm saying, but throw in some walking, build up to it, start with a walker, okay? And then again, you could do maybe 5 minutes with a walker, do a minute without the walker, do 6 minutes with the walker, 2 minutes without the walker, 7 minutes with the walker, 3 minutes with, and little by little, we start to shift the emphasis from lower level activity to higher level activity. Okay, Carolyn says, I had the same problem after pulmonary rehab. Love the treadmill and could, quote, walk the treadmill easily for a half hour with no problem. All right, let me start with that, Carolyn, because you, I know for a fact, are extremely educated. So if you, I'm going to tell you right now, you should know a little better than this, because if you can walk on the treadmill easily for a half hour with no problem, then you need to turn up the intensity, girl, because you are taking it too easy on yourself to get the maximum benefit, okay? So little by little, start to increase the intensity. As soon as I tried a nice walk outside, I was SOB, aka short of breath, not blah, 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 within a half a block, and my heart was racing. The heart problem has been corrected, but still cannot walk any distance outside. It's just different breathing in outside air. Weather extremes are triggers, but we have a mild climate where I live by the beach, which should be ideal. Okay, so many, okay, so let's look at this fancy crew right here. Moncachino, what you think? All right, so let's start with the breakdown. So inside air versus outside air. Absolutely. Is there a difference? Yes. Inside, it's a controlled environment, okay? There's no blazing hot sun. There's no freezing cold wind, okay? We can control the temperature. We can control the humidity. We can control other factors, okay? But when we try to figure out what is the issue here, okay? A lot of times people make assumptions. There's like a knee-jerk reaction. It's like, oh, my knee creaks, it's arthritis. Oh, I'm wheezing, it's asthma. And clinicians do it too, doctors do it, patients do it, but don't assume it's the air. How do we know what is what? And we try to do a differential diagnosis. So let's do a differential diagnosis on this. So Carolyn, you say that the air is good, okay? So you have your air, okay? Whether you have good air, hot air, cold air, humid air, dry air, okay? Those are your conditions. You're not going to change California, okay? Sorry to tell you this. No matter how much rehab you do, you will not be able to change the California weather, okay? But you can change yourself, okay? So little by little, I would suggest starting to walk in these little environments, okay? I don't... Give me 1 second to pull the post back. So maybe it's the air, but we're all dealt a certain set of conditions, okay? So we want to work within our conditions. So again, same principles apply. First of all, let's talk about a couple of things that you specifically mentioned. The heart rate was racing and it was corrected. So that leads me to believe that either you had an arrhythmia, you know, whether it be a supraventricular tachycardia, whether it be an atrial fibrillation, at a minimum, you had some kind of tachycardia that you say was controlled. So maybe you got some medication for it, maybe you got a beta blocker or something else to control your heart rate. So that's one thing, okay? But you still can't walk any distance outside. And again, I would say that you can, but you have to start somewhere. So if you tell me that you can only walk a half a block, I would say this. You walked a half a block, maybe you started out too fast. Maybe the air did hit you and did cause your airways to constrict. Maybe you were getting anxious because you were thinking, oh my God, I'm not on the treadmill. Now I'm walking outside. There's all these people around me. Oh my God, what about this California air? Blah, 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 blah. And think about it. Anxiety has the impact of making you nervous, increasing the adrenaline production, fight or flight response. Okay, so, and now I'm starting to breathe shallow and fast, and that's causing my airways to constrict, and now I'm getting more anxious, and it's this cycle. So again, I encourage you, stop, talk to yourself. I know what to do here, okay? Start out slower. So if you can only walk a half a block, I would say this: catch your breath and then repeat that half a block at half the speed, okay? As that may be too slow, but I'm telling you how to teach yourself how to train yourself, okay? So if you could do a half a block and now your heart is racing, which is now gone, and you're short of breath, blah, 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 stop, catch your breath. When you feel rested, do that same half a block, okay, at half the speed. And then you're gonna go, oh my God, I can do it. Well, what happened? I walked too fast. And then I started thinking about all the things. Why am I short of breath? What could it be? It could be the California air. It could be all these people around me. Oh my God, am I having an asthma attack? Am I having a heart attack? No, I just set out too fast. And then I drove myself crazy by thinking about all the things that could be going wrong. But really, everything was okay. Okay, so then when you realize that you could walk that half a block at half the speed, then you have a decision to make. Do I want to walk a full block at this half the speed, or do I want to walk a half a block at 3/4 of the speed? I would always encourage you to increase time and distance, because intensity is naturally going to increase on its own, okay? As you start to feel better, you're naturally going to walk faster, you're naturally going to walk you know, at a more natural pace. So I would say little by little, start to increase the distance, increase the time, focus on taking nice deep breaths in through your nose, out gently through your mouth, using pursed lip breathing. And incidentally, all this stuff is in very organized detail on the webinars at www.pulmonarywellness.com in the webinar section. And there's many exercise videos in which I do this in a little bit more organized way. Okay, so let's talk about this. So Shirley says, same here, and my legs hurt. Okay, so your legs may hurt, okay? There may be reasons for it, arthritis, muscle issues, blah, 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 blah. But again, you have to expect that there's gonna be some soreness, and this is normal when you begin any type of exercise program. So again, I would say, start it out, add your 30 seconds a day. And if no matter what you do, you still have hip pain, knee pain, ankle pain, foot pain, joint pain, muscle pain, then get these things checked out, because there often are things, okay, that could definitely impact our ability to do things. And maybe it is arthritis, and maybe it could be treated, and maybe it is plantar fasciitis or blah blah blah. But my point is that, you know, exercise is not supposed to be comfortable. Okay, I'm not a believer in no pain, no gain, because I think that pain is a warning signal and you have to heed the warnings. And I'll always emphasize safety and caution, and you know, I'll always emphasize you know, erring on the side of caution. However, you know, there's gonna be some discomfort, and as you get stronger and as you get fitter, some of that will go well. Okay, wow, I've got lots of company. So happy to hear from all of you. Yeah, and oxygen makes absolutely no difference. Okay, Janet says oxygen makes absolutely no difference, and oxygen may not make the difference. Okay, most times when people are short of breath, it is not because their oxygen saturation is low. So in your case, okay, if you say that your oxygen is 95%, 95% is like a full glass of wine. So if I add oxygen to it, aka keep pouring wine into that already full glass, okay, then I could tell you right now, you're going to wind up with a lot of wine on the table. And you, unless you're, you know, one of those people who doesn't mind, you know, sucking that wine up off the table, which, hey, no judgments, but oxygen is not the answer. Breathing is the answer, because very often, and this is another question I get asked all the time, I don't understand this, my oxygen saturation is 96%, yet I'm still short of breath, because shortness of breath is not solely an oxygen issue, and more often than not, it is an issue of breathing mechanics, okay, some of which are fixed, meaning because of your lung situation, some of them are behavioral, meaning because of the pattern that you're using, and that's where all of these breathing patterns come in handy. But it's almost never solely an oxygen issue. So whereas some people may need to use oxygen during their exercise, and those would be the people that do desaturate with exercise, most people will not benefit from oxygen if lack of oxygen is not the reason why you're short of breath. Monkey is acting crazy, so someone must be behind us. Who is it? All right. That dog didn't want to play. All right, so again, let's go here. Monk, get up here. Get up here. We're working. All right, so let's continue. Weather here in Sarasota has become milder and yes, humid, and I walk in the early evening. So here's some tips. If you live in a place where it's hot and humid, walk in the morning before the sun is at its highest, before it's at its most humid. Walk in the evening after the sun, you know, starts to come down and it gets a little bit less humid. If it's a cold environment, okay, I'm not advising that you go out and walk, you know, in the snow and the wind and the ice, blah 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 blah, but you have to you know, you're gonna have to figure out something out for the alternate during the winter time. So whether it be walking in the mall, whether it be walking in a grocery store, whether it be walking on a treadmill, but again, work on some of these. You have to, you know, again, you're not going to change weather no matter what. Same problem here in upstate New York. Okay, thank goodness for you lot. I thought I was doing something wrong and nobody around me can understand this problem. What is the explanation for being able to do the business on the treadmill and not be able to walk in real life? And you know, one of the frustrating things for patients and for me, and the number one reason why I decided to, you know, years ago start this webinar series and this education series is because I got news for you. You guys are confused. A lot of clinicians are confused too, and if clinicians don't really understand this, then you guys really, you know, have no way of knowing it. So you are all asking very, very good questions here. What did you say? What did you say? You're asking good questions. They're common questions. Everybody, you know, many people go through the same thing. And what I don't understand is why, you know, there's not a standard, why we keep reinventing the wheel over and over and over again. Excuse me, senor. Sit. Why we have to keep inventing the wheel over and over and over again, and we don't, okay? And that is why, you know, it is taking me a long time, but my book is coming, I promise you, Ultimate Pulmonary Wellness. But the webinars, there's nothing that's going to be in the book that's not in the webinars, okay? All right, so Lisa says, I've come to the conclusion, because I have the same issue, when my arm swings, works my heart more, making me need to use more O2. If I keep arms at my side, not much struggle. So Lisa, that is extremely intuitive. It is also correct, okay? But there is also some benefit to swinging the arms too. But you're right, okay? The more muscle you use, the more myocardial and overall body oxygen demand. So we talk about oxygen. Come here. This guy has an attention. Okay, so we talk about oxygen demand. So how your body uses oxygen is based on three main things. Number one, how good are your lungs at moving air in and out? How good is your heart at pumping blood? How good are your muscles at using oxygen? So the more demand we have, so moving your arms and legs is certainly more demand than, you know, moving just your legs alone. So you're going to need more of a supply. But again, we have to first take stock. Before I could tell you what you should or shouldn't do, we have to take stock as to where are we right now, and then start making adjustments. Okay, Patrick says, when my controlled environment changes, my oxygen saturation seems to be effective, sometimes drastically. And it could, but I don't believe that in most cases, if you're breathing and your oxygen saturation is 96% indoors, I don't think that just changing the environment, unless it's a major change, is going to be enough. I think we have to look at some of these other factors like breathing pattern, and you know, these are some things we can control. We can become more aware of our breathing pattern. We can you know, we can make some of these changes by becoming more educated. Okay, so now Dennis says, back to your original question, lung capacity trainers like the incentive spirometer on the left and the ASI respiratory trainer on the right. We should all be using the spirometer daily. Check with your pulmonologist before using the ASI trainer. All right, so let's talk about assistive devices for breathing, okay? Muscle trainers, inspiratory muscle trainers, expiratory muscle trainers, and so on and so forth. So whereas, now listen to what I'm about to say, because I'm not putting them down, I'm not building them up, I'm just going to tell you the fact, okay? There are a lot of devices on the market. When we talk about an inspiratory muscle trainer, we're talking about breathing in against resistance. And if you think about what that is exercising, we're exercising the diaphragm and the inspiratory respiratory muscles, okay? An expiratory muscle trainer, I haven't necessarily seen this advertised as such, but is where you're blowing out hard against resistance. And what are the main muscles involved in that? The abdominal muscles, okay, which are the main muscles of forced exhalation, whereas the diaphragm is the main muscle of inhalation. These devices, okay, can be beneficial as an adjunct to exercise, which means that if you want to use a muscle trainer and your doctor's okay with it, because there are some people that should not be using, you know, breathing trainers against resistance, so ask your doctor. Just like balloons, okay, I'm not a fan of blowing up balloons as a muscle trainer, okay, but these things, okay, may be helpful as an adjunct to an overall exercise program. And whereas I know there are people, oh, that's your friend? Whereas I know there are people who are hoping that they're going to start breathing into this device for 10 or 15 minutes a day, and then all of a sudden they're going to be able to walk. That is not going to happen, okay? And as far as the incentive spirometer, which is the device that you get, very often people get them post-surgically when they're in the hospital, and they're asked to either raise the balls, you know, so you breathe in and the balls go up. Let me tell you something about that, okay? And I'm not saying that it's bad for you, and I'm not saying that you shouldn't do it, okay? However, okay, walking around will most times give you a greater volume than the incentive spirometer. So I don't want you sitting for 20 minutes and going, I'd rather you get up and walk and use your respiratory muscles, okay, in a way that's much more natural, that's also going to give you the benefit of being able to walk more, okay? So if you have it, I would never tell somebody don't use it, but it's not going to give you the great benefit that many people think that it's going to give them. And again, like I said, your body gets good at doing what you ask it to do. So if you ask it to do the incentive spirometer for an hour a day, it's going to get good at doing the incentive spirometer an hour a day. But again, that doesn't mean you are going to be able to walk. All right, what else? I have the same problem. Hope to hear about combating this problem soon. Thanks, Dennis, but wonder why said anything about these trainers, nor did Mayo Clinic Jacksonville after a full week's workup. Apparently this is a common problem. Okay, so, you know, let's start off with this. You would think, or one would think, or you would think that, okay, I don't have to go any further than this election to say that you would think that should be thrown out, okay? You would think that your doctor would tell you about this. You would think that your doctor would tell you about pulmonary rehab. You would think that your doctor would tell you what orders you should take your medication in. You would think that your doctor would tell you how to eat it. Forget about it, okay? It's not gonna happen, okay? So let's forget about that right now. Why wouldn't a doctor tell you about that? Many don't know, many don't have time, many don't care. Now, there's many great doctors out there, so don't get the idea that I'm saying doctors suck. Trust me, I work with great doctors, and they don't all do that either, but they at least tune the patient into places where they can get the information, okay? All right. My hospital uses the spirometer to anyone with surgery or exacerbation and is admitted, okay? So the spirometer is absolutely indicated after thoracic surgery. The incentive spirometer is absolutely indicated after abdominal surgery or any surgery in which you've had anesthesia, in which you've been intubated, in which you're gonna be on bed rest, because you cannot do those other things, okay? But again, once you're up and walking around, put the spirometer back on a shelf, painted gold, put a plaque under it with your name. Don't need the incentive spirometer anymore. I am stuck in the same boat. It's baffling. Well, hopefully you're no longer baffled, okay? Carol said, I think it has something to do with what Noah called breaking the chain. Close, but you remembered. Okay, next, Alice says they would encourage us in pulmonary rehab not to hold on when on the treadmill, can only do a little time, but it gets better. Okay, so with that, that's a real tricky one, okay? We want all our patients to hold on, okay, unless they're good enough to either jog or run. And the reason for that is, you know, a lot of people, for whatever reason, do not feel comfortable and do not have the right balance and are not safe to walk on the treadmill without holding on, okay? If you are, I'm not saying you shouldn't do it, but for me, safety is the #1 concern, and I would hate for you to come to rehab for 24 sessions and that one time that you lost your focus and you fell off the treadmill and broke your hip, and then we undid all our rehab. Okay, so again, I'm not trying to be a pessimist, I'm just saying safety first, okay? You said we were also given arm massage exercises to strengthen your respiratory muscles. I stopped them for a while, but try to do them for at least 10 minutes. Now, arm massage is great, okay? And upper body exercise is particularly challenging for people with respiratory disease, because another thing is that when you're doing this overhead upper body activity, particularly again over your head, okay, you what someone's trying to steal the show.
Monk, speak.
All right, so particularly, get out of here. So particularly overhead activity puts the respiratory muscles at a very poor mechanical advantage. Which is incidentally why so many people report difficulty when they're in the shower and things of that nature, amongst other reasons. So arm exercise, while they are good, I just want to clarify one thing, Alice, which is that they're not specific. They definitely will help the respiratory muscles, okay? But it's also getting you used to performing activity at a poor mechanical advantage, because as I mentioned, your body gets good at doing what you ask it to do. So if you ask it to do these things, you start off slowly, build up your intensity over time, build up your time over time, and that is very beneficial for you. So Alice, somebody asked, how does one do arm massage? We say this all the time. I promise you, in the next month, we will put out a tape of the arm massage so that you can could do these at home. Okay, and I see that Suni posted Burke's arm massage, okay, and my team is going to do it. We'll do it for you a little bit differently, and we'll put out both a 7.5-minute arm massage and a 15-minute arm massage for you. All right. So Helen said, but in spite of doing all this, I still can't walk without SOB. We've covered that. That sounds like a good idea. Noah Greenspan said, we'll address this post on Saturday in detail. As I told you, there is a lot here. Looking forward to Dr. Greenspan. So citizens gain weight, what time of day do you walk? Weather, humidity, incline, good points. Jill, Pammy mentioned something very good here. I'm thinking that perhaps the reasons for SOB outdoors could be triggers such as pollen, wind, humidity, heat, cold, mold, exhaust fumes from traffic, etc. I have no trouble most days in rehab walking laps. It is different outdoors and improves when I wear a mask. And absolutely, you know, if the wind is a trigger and it's windy outside, that's going to affect you. If the humidity is a trigger and it's humid outside, that's going to affect you. If pollen is a trigger and it's the middle of pollen season, that's going to affect you. If, you know, exhaust fumes are a trigger and it's hot summer in New York City and it's a high ozone alert, that is going to affect you, okay? Absolutely. So after this very, very long and hopefully not too drawn out, you know, thing, you could see there is a lot in this post, which is why I decided to address it in this way. You know, so there's a lot there. Hope this answered the questions, and hope you have a great weekend. And goodbye from me, and goodbye from Senior Monk, and goodbye from sunny and beautiful New York City. Have a great weekend, everybody. Hey, let's go. Should we do it? Let's go. Let's go. What? 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 You're crazy, man. You're crazy. Let's go.